Welcome. Thank you. My name is Gina. Again, I am program manager at Community Health Partnerships at the Indiana Clinical and Translational Sciences Institute. And I am so happy to be able to work with this team of rock stars that you're going to hear from today. They were all just highlighted in the opening session, and you can read more about all the amazing work they do in the agenda. But just really briefly, today leading this session that is Let's Go on a Coalition Trip is Courtney Stewart, who leads the Indiana Joint Asthma Coalition, Erin Zich, who is a data analyst for Connections in Health, Antonia Sawyer, who leads the Hoosier Health and Wellness Alliance, and Lily Darbishire, who is a registered dietitian and Ph.D. candidate at Purdue University. And so feel free to use the chat box for questions. Erin has dropped a link to the Coalition Trip website in that chat box as well. And on that note, I'm going to hand it over to the team.
Okay, welcome. Thanks for the introduction. And let's talk about going on a coalition trip. So Erin, if you'll advance to the next slide. So yeah, I'm getting a little feedback too. Try to turn my volume down a little. Okay, is that better? All right. Okay, so the purpose of this session is to kind of go through the website with you all and talk about what Coalition Trip is. So we want to guide community health leaders, building and maintaining successful coalitions using this website. There's a lot of tools here. And this is a part of the Indiana Clinical and Translational Sciences Institute, and it's a part of the Community Health Engagement Program, which is something that Karen Henshaw mentioned in the opening. And I do want to mention our partners. We partner with Purdue Extension. Yeah.
Your audio is still pretty echoey. I don't know if there's anything you could do to troubleshoot that.
I'm not sure. Let me check. Settings.
I think everybody else is on mute. I was checking for that, so I don't think that is the issue.
Is it better now?
You don't have your phone playing or anything on here as well, do you? Okay.
No, I don't.
Okay, well, I think it might be a little better. We'll keep going. I'll interrupt you again if it's not.
Okay, I'm going to turn my volume down.
It's better.
Okay. So I want to mention our partners, Purdue Extension. They have educators in 92 counties, and I'm seeing some familiar faces with folks I worked with when I was at Extension. And they've got over 75 health coalitions, probably more than that actually, across the state. So we do partner with Extension in that regard. And Erin, if you can. Thank you. So when you're on the website, you're going to see the link is right here. So if you want to copy that, I know Erin put it in the chat and that's available for you. You will see this box and you'll see Coalition Trip. If you just click there, you can go to Google and type in CTSI, Indiana CTSI, and you'll get there.
Hey, Courtney.
Yes.
Just for the sake of the audio, I'm going to have Antonia. Do you mind, Antonia, to take over? And Courtney, maybe you can troubleshoot on your audio.
Sure.
Okay, thanks. Sorry. Go ahead, Antonia.
Hello, Antonia Sawyer. I lead the Hoosier Health and Wellness Alliance. I'm happy to take over. Courtney, I'm sorry about your audio. Yeah, when we talk about Coalition Trip, I think the first stop is making sure that you can find your way to the website. So first, if you would like to find Coalition Trip outside of this breakout session and our chat box link that we've provided, you're going to want to go to Google. You can Google the Indiana CTSI, Improving Health Through Research. You're going to click on that link, and then you're going to go ahead and find the Connections and Health links up in the toolbar. You'll drop down, you'll see Coalition Trip there, and then you'll be able to click on that link and find Coalition Trip. And as Courtney mentioned, this is a free resource that The Indiana Clinical and Translational Sciences Institute has created 4 statewide partners to be able to locate a multitude of tools that can help you build your coalitions, identify if you need a coalition in your community, and so on. Next slide, please, Erin, and then we'll go into the tools that are available. So what tools are available? First, does your community already have a health coalition? This is going to be a tab that helps you understand how to identify and find out if your community has a health coalition. Is the journey worth taking? Do we have the time, the capacity, the resources, and the manpower to be able to build a coalition? You ready to take over, Courtney? All right, take it away at Travel Partners.
I'm going to give it another shot, you all. Sorry.
Hey, you're better. You sound great.
Less echoey. I guess I was in here twice. I was so excited that I joined twice. So my apologies. It's not Zoom without some glitches if I'm involved. So thanks, Antonia. Tools to build coalition success. So when we're thinking about building coalitions, or if we're thinking of maintaining a coalition or just kind of reinvigorating one, these tools are great because they can start you from the very beginning. If you've already got a health coalition, you can start there and use tools to move forward with that. If you're thinking about starting a health coalition, there are a lot of valuable tools as well to get you started. So when we're thinking about, is the journey worth taking with coalitions? Is your community ready for a coalition? Why do you want to start the coalition? And perhaps you can partner with existing folks. We don't need to reinvent the wheel. So there's some very practical applications with this part of the website. Thinking about travel partners on your coalition trip. Questions to ask would include, again, who are potential partners and what are the goals for the coalition? And with this part of the website, you'll find a lot of valuable information to assist you with partnering when you're working in coalitions. And prepping for your journey and prepping for success. This part of the website will give you links to planning coalitions, forming coalitions, thinking about things like mission and goals. The Indiana Joint Asthma Coalition has recently revamped our mission and vision. So that's definitely part of that prep process. And then thinking about sustainability. And travel budgeting refers to your finances for the coalition. If you are going to apply for grants, there's information about how to apply and write successful grants. If you're working with donors, if you're fundraising, and then you also need to think about your staffing and the budgeting there and the time that folks have to be involved in a coalition, which is a very important part. Hitting the road, setting up the structure, facilitator guidelines, who's going to do what, setting meetings. You know, when you have a coalition, you want to make sure that the meetings are at a time that work for people, that they're consistent, that you're tracking goals and you're evaluating the coalition as you move forward. Staying innovative, that's what's going to keep folks interested in your coalition. Is there reciprocity? Are you moving forward? Are you meeting goals? Are you allowing coalition members to share what they're up to and be involved in that process? Enjoy the journey is gaining momentum, sustaining interest again as you move forward, and sort of that consistent evaluation of where you are in the coalition and what you're doing with your goals. Roadblocks, you'll find information here for common issues that are faced by coalitions and how to work through those. So those include things like perhaps there are group dynamics that are not working, a loss of enthusiasm, seeing your membership participation change, planning and resources, perhaps those need to be shored up. And then things like outside issues like legislation that can impact our coalitions. And then ending the journey, you'll find resources about thinking about the life of a coalition. Sometimes a coalition will meet its goals and there's no need for the coalition anymore. And it's possible that they've disbanded, or perhaps they're ready to take on a new challenge. Next slide, please. So again, if you're thinking of starting a health coalition, you don't have to duplicate efforts. You can find partners. Think about why you're starting the coalition. Is it the right choice? And think about if your community is ready for a coalition. And again, you'll find the tools on Coalition Trip to help you with that. You'll also find resources for planning and policy, how to engage in social action, a lot of information about starting coalitions and organizing for community change. Next slide, please. So something I want to mention about destinations, connections in health. We are working on gathering data about Indiana coalitions. So coming soon, which means by the end of 2021, we will have a map that will have coalitions across the state and their service areas with descriptions and also contact information. And currently on the website, there is a link to a map with coalitions that are represented by Purdue Extension. So that is available at this time. And at this point, I'm going to turn it over to Miss Antonia Sawyer again to take it over from here.
Thank you, Courtney. And I'm so excited you joined us twice and that you're twice as excited about being at our breakout session. So going over some of the tools that Courtney was talking about, and if you were in the beginning discussion before the breakout started, communication is a huge tool that I think helps impact the entire journey of a coalition, whether it's a health coalition, it's a task force, it's a community group, anyone that's coming together is going to want to develop a style of communication that meets the group's needs. And I think that can highly impact whether you're hitting the road and getting just started on your communication and your coalition goals, all the way to ending the journey and communicating, hey, I don't think we need to meet as much, or I think we do need to switch gears. And so I think the very first thing when I started working with the Hoosier Health and Wellness Alliance, then Indiana Healthy Weight Initiative, was the frequency of communication, just communicating, period. Frequency matters. So I had come from a community-based coalition, not a statewide coalition lens. And so I got I think I speak for many when it's the standard practices of how coalitions communicate and meet do not always meet the group or coalition members' needs. And I was kind of old school taught with Robert's rule of order, and we had motions and policies, and we met once a month and it was for an hour. And honestly, that doesn't always work for everyone. And especially in a chaotic pandemic world where we might not have an hour to meet with the 10 different coalitions we're on. Maybe it needs to be a half hour, maybe it needs to be virtual. So it really comes down to asking members what they prefer to keep them engaged and not overwhelmed with too much communication, not enough communication. You want them to feel engaged, but not kind of bogged down. So at the bottom on the left hand of this slide, there is a super easy, how often should we connect? And I know it sounds super basic, but it really can change the entire climate of your coalition. So are we meeting are we connecting every day, every week, every month, once a year? And how many times are we connecting? Are we connecting one time a month, 2 times, 3 times, 4 times? So really think about the frequency in which you're meeting with your group or just communicating and connecting with them. It might not be a meeting, maybe it's between meetings. Can you move any of your meetings to be kind of email based so that we're not bogging folks down? I also would say that when we're working on communication with our coalition members, that we want to encourage open communication outside of what is initiated by leadership. So initially, when you start a coalition, we have a coordinator or a director or a leader, and that person is kind of the one that mass emails everybody, gets the agenda together, make sure the minutes are distributed amongst everybody. However, there's a lot of action and things going on with coalition members and group members and task force folks. So how do we get them to cross-communicate with one another and collaborate with one another outside of direct leadership? So facilitating cross-communication and collaboration by encouraging members to communicate with one another is huge. And I know there are several of the Hoosier Health and Wellness Alliance Coalition members on this breakout today. And I think they would say, yeah, okay, at first Antonia was doing all that communication. And then it was, hey, she's encouraging us to send flyers out to folks and us to reach out and ask for collaboration opportunities. And then, of course, have other people email, because a redundancy of communication from the same person can get someone to unplug. Nothing against the leader. It's not that that person's not a great, fun one to be around, but it's, I got another email from Antonia. Lord help me. So I try my best to not bog too many people down with my emails. I've been told in the past that people create files for my emails. So I take that feedback seriously and try to say, how can I adjust my communication and listen to the needs of the coalition members? So please consider frequency if you are starting or even in the middle of a coalition right now that's kind of like weighed down, like, okay, well, we're meeting once a month because that's what we've always done. We don't always have to do it that way. We make the rules with our coalitions. So please do consider your frequency, and then of course, encourage open communication. You got it, Erin. You were following me. Go ahead. And something super awesome that we've been able to do with our communication is provide useful tools for our groups or coalition members to use to further facilitate that communication. So what you're looking at right now is a Hoosier Health and Wellness Alliance membership map. And this was actually a suggestion from Sarah Naramore, who is a coalition member. And she said, hey, you send out our listserv every month. Do you have a map that shows where all our members are? Or I can easily isolate a county and find out all the members in that county so I can connect with other hospital systems across the state to see if they're working on what I'm working on. So in taking that suggestion, I worked with Aaron, and he's going to show you how to work with tools like this to see if creating something like this is within your goals for your own group. But I said, Aaron, do we have something? And through using Tableau, he was able to create a map for us. And this makes it super easy to access members across the state or the county region. And so if you're a statewide coalition, this works perfect for across Indiana. If you're a local coalition, Aaron can show you how to do this by zip code, so you can see where your membership is within your county. I think it's extremely important when we talk about diversifying coalitions. And yes, Tanya, this map is on our website. When we're trying to diversify our coalitions and our membership, finding out where folks are from which neighborhood at a county level, which part of town, and specifically for Hoosier Health and Wellness Alliance, it's what part of the state. And so I'm going to pass it over to Lily Darbishire. She has been doing functioning and effectiveness surveys with the Hoosier Health and Wellness Alliance, which is a great way to keep track of our communication and to kind of show the growth over time, and also to give me what I need to make sure that I adjust my leadership and communication to meet the coalition needs. So with that, Lily Darbishire, take it away.
Exactly. Thank you so much, Antonia. Yes, you're exactly right. Because communication is such an important aspect of coalition work. It's really important to be able to find a way to keep track of how you're communicating with your coalition members. So today I'll show you how we kept track of communication at the Hoosier Health and Wellness Alliance, and how to focus on clear, effective communication, or on how our focus on clear, effective communication was able to increase our communication evaluation scores, as well as increase collaboration within our coalition over time. So what we did to measure communication within the coalition was took a valid and reliable survey from public health literature. So me being the Ph.D. student on our team, I just simply searched the literature for something that was already out there, but made sure to adapt it to suit our coalition's needs. And it was important to have that valid and reliable aspect. And if you're not familiar with what that means, it's basically just saying that the coalition or the survey questions are statistically analyzed to make sure that we are measuring what we want to measure. And so there are some tests out there that can tell you that. And so our survey was adapted from Todd Rogers. It was a 1993 survey on statewide tobacco cessation coalitions. And as I mentioned, we kind of adapted that to fit our needs. And the goal of our survey, as Antonia mentioned, was to measure changes in coalition and functioning and effectiveness over time. And especially, before Connections in Health, that whole program started, and then after to see, are we doing a good job? What do we need to change, et cetera. So as you can see on the screen here, we asked coalition members to rate their perceptions about factors that we know that are related to coalition success. So communication is a great example of that. And this is an example of our communication question. But we also asked things like leadership efficacy, satisfaction with coalition activities, understanding how the coalition operates, and among other things. So for the sake of time, obviously, we'll just focus on our communication and leadership scores, because we want to demonstrate how our Connections in Health model of communication either increased or maintained these scores over time. And then at the end, I will demonstrate how we also were able to increase collaboration among the Hoosier Health and Wellness Alliance coalition members over time. Thank you, Erin. So what you're seeing now are the results from the Hoosier Health and Wellness Alliance's communication survey. So the blue bars represent communication scores before Connections in Health was implemented, and the yellow bars are 1 year later. So within that year, like Antonia was mentioning, HHWA really established their leadership and communication skills. And with Antonia being the new lead, we really tried to either increase or maintain our scores from 2019. And you can see here that we were able to do that. And so we looked at things like the quality of communication, the frequency of communication, whether or not it was informative, if it was comfortable, if it was effective. And, the nice thing about these surveys too is, say even if your score has been maintained over time, it still makes a really good talking point. Like Antonia was saying, frequency of communication, we see here that on average, we're looking at about a 5 out of 7. And that is up to the coalition members to interpret whether that is a good thing or not. Maybe we don't want to keep increasing the frequency of our communication, but it's really important to bring that up to your coalition members to understand, are they happy with that? Do they feel like their communication is informative? Is it effective? So these are really good ways to be able to, first of all, just visualize these scores. And second of all, just bring up really good talking points to see what works for your coalition. And it's kind of the same thing here with leadership. And I just wanted to bring up leadership because I felt that with leadership, it really affected how Antonia communicated with her coalition. Okay, so for example, asking for help. We saw that in 2019, it was high, and then it went a little lower in 2020. So again, that's just a really good talking point to bring up, is that something that the coalition members want? And not to say just because the score decreased, it means like, oh my gosh, we have to make all these changes. It's just a good place, starting point to bring up with your members, is this something that's important to you? Would you like to take on more projects? Would you like to take on more tasks? And you can see too, just knowing in 2019 that our social gatherings were way down, we made that a priority in 2020. And you can see that that just increased phenomenally. And that was all during COVID. So having these, visual representations of the perceptions of the coalition members is a really good way to just be able to see where you're at with your coalition and make changes accordingly. Antonia, yes.
Yeah, I just wanted to comment that this also is a great opportunity to not make assumptions about what you think your coalition may need or want. I think, and asking the tough questions, because, they could have said, here they say Antonia seeks my views and it did go up. Had that gone down, that's a great way for me as a leader to understand that I need to improve. on how I'm communicating and reaching out with the coalition members and the volunteers. And to complement with the social gatherings, we were able to do that on Zoom. And so I think that's another thing, not assuming that folks don't want to still connect during the pandemic. It's how we do that and how we communicate. We want to do that, which can keep us cohesive and growing. So thank you, Lily.
Exactly. Yes. Thank you, Antonia. And Erin, if you want to go to the next slide, just have one more thing that I want to highlight. So we also feel that our focus on communication has been able to increase collaboration among our coalition members. So what you're looking at here is a social network analysis on collaboration between coalition members before, that's the graph on the left, and after, the graph on the right, Connections in Health was implemented. Okay, so the blue dots that you see are coalition members, and the lines between them mean that they are collaborating. So we saw that 1 year after Connections in Health was implemented, first of all, you just see more blue dots on the right-hand side. But not only that, but you see more lines between the coalition members, indicating that there was more collaboration taking place in 2020 after we implemented the Connections in Health partnership and Antonia took over leadership. So this was a really great way to be able to visualize how our coalition members are communicating, or in this case, collaborating with each other. And the last thing that I will mention about this graph is that, so you see some blue dots that are hanging out on the left-hand side that are not connected with anyone at all. And so you see in 2020, even though we grew in membership, we see that there were less people who were not collaborating with anyone. So again, I think this just shows that we've done a really good job of increasing communication and collaboration among our coalition networks. So yeah, I will now pass it on to Erin to talk a little bit about data visualization.
Thank you, Lily. And I think it's especially important to take what Lily has shown and know that there was so much data collected in the background, but it's challenging to communicate that data. But when you put it into a visualization like she had, you can see the clear and apparent differences between 1 year and another. And using data visualization is just, it's vitally important, especially from a coalition perspective, when you're communicating with local folks who may not be as familiar with the data, who haven't been integrated in the process. It's really important to be able to communicate effectively the work that's being done and how it's being evaluated. And so one thing that's in addition to the way that Lily was visualizing data is mapping. And so with our coalition efforts, we have a lot of opportunity to visualize via mapping. And there are a few major mapping tools. And as Antonia mentioned, we made our maps with Tableau, or I should say specifically that Hoosier Health and Wellness Alliance dashboard. Another common one is GIS, Geographic Information Systems. These are what you will see commonly used to display any sort of dashboards, mapping. For example, if you're looking at COVID data, it's a lot of mapping via Tableau and GIS. But the challenge with those is those are really expensive. You might not have access to them. They have licenses associated with them, but they're very powerful. So it might not be the best idea to try to pursue getting one of these systems and maybe pursue something more free. So I wanted to talk quickly about Data Wrapper and Visme. And so on the right, you can see there's a smoking map, a smoking prevalence in Indiana. This was created with Data Wrapper, and there's still power in mapping using a free resource rather than using a paid expensive resource. And this is something that you can quickly utilize on a local level. And like Antonia mentioned, you can do this, census tract, zip codes, county, you can do it by state, however works best for you, you can do that. So on the next slide, I wanted to talk briefly about the functionality of this map and how it was useful for us. I'm not gonna go into it too in depth just for the sake of time. However, this provides members the opportunity you can select each county, you can see who's in that county, you can see county density, where there's a lot more folks who are working in the area. And then you can also get in contact with those people. So if you select their name on the right side, it'll automatically email them. So there's a lot of functionality, and with data visualization and mapping, there's just a lot of opportunity for you to really evaluate and push your coalition efforts. So some of the data that's presented on coalition trip, when you're visualizing data, you need data to display. And so there's a few resources that are here. A lot of these are ones that I'm on daily. So Census Bureau is great for demographic information such as median income, employment. Savvy from the Polis Center at IUPUI, I've worked with them so often, and they're experts in data visualization. And this provides a lot of insight into local communities and great data on health equity and COVID-19 throughout Indiana communities. County health rankings, I will be biased to say this is my absolute favorite one. This is what we use, for the most part when we're doing our community engagement as part of Connections in Health. This informed a lot of our efforts. So this is on a county level to look at health factors and health outcomes. The Atlas of Rural and Small Town America is from the USDA. It's great for looking at socioeconomic factors on an individual county level, such as jobs, poverty, rurality. Stats Indiana is kind of a one-stop shop for Indiana data, and it can even go more granular than most of these other ones to kind of a city and town level. Mapping the meal gap focused on insecurity and meal costs, talks about food banks throughout the state, and then Places, which is specifically valuable to Connections in Health because it's focused on chronic disease chronic disease outcomes. So it provides interactive maps and models for, I think, 27 measures at the county level. And then lastly, not using data resources, but talking about, data collection of your own. There's a couple of resources. We use RedCap mostly. We have access to Qualtrics as a part of our institutions, but there are free options, collecting data in Google Forms, and everyone's heard of SurveyMonkey. These are very powerful tools for you to assess your communities and your coalitions, populations, as you see fit, if there's data that you need to collect. So for example, we've done a lot of listening sessions over the last 2 years in communities. When we're working within communities, we want to hear from folks. And so this is a lot of qualitative data. And so we're collecting information such as, who's impacted by the challenges related to chronic disease, who's working on these. So taking this data, analyzing it, and then using data visualization to display it back and communicate it back to the community is kind of the most valuable part of data visualization. And it allows you and your coalition to drive your decision making and making true changes within your communities that are actionable, and you can see what's going on. So I know we're at 10:52, so I think we are ready to take some questions. If anyone has any questions for us, we welcome having any questions on any parts of this presentation.
Thank you, guys. That was a really nice highlight of tools available in the website, and I just put it in the chat again in case people joined later or it got to the bottom of your chat box. So there is the Coalition Trip website that has some of the tools that have been highlighted. We have a question. Do you offer coalition or community engagement coaching?
Should I take this one?
Sure.
So I would say that the Hoosier Health and Wellness Alliance, I would be more than happy to work with any health coalition in the state. And if we have tools that we've used, or you have questions about communicating with your community on what you're doing, because as Erin talks about, we collect a lot of information and we visualize it, but how are we communicating that back to our stakeholders so that they understand what work we're doing and can continue to grow membership. So I would say formally, am I a coalition engagement coach? No, but I'd be more than happy to give some of my time and answer any questions or talk with you about kind of where your coalition is and where you're hoping that they could go.
And I would add on to that for community engagement efforts, the Community Health Partnerships Program at the Indiana Clinical and Translational Science Institute does offer both consultations and then other more more formal professional development opportunities as it relates to community engagement. So I'd also be happy to help. If you email the team, we can get you connected to resources. Other questions or comments about things that you've tried in your communities in terms of evaluating coalitions' growth or success or needs?
So I want to just jump quickly on a question earlier from Tanya about the map being available. So this Hoosier Health and Wellness Alliance map that we talked about today is not yet up on the website.
Oh, my bad.
No worries, no worries. I didn't want to correct you. It will be available, and for all of the coalitions within Connections in Health will be available in the next month or two up on the Connections in Health websites. As for Coalition Trip is going to be the main host for the coalition mapping project once that is complete, and Courtney talked about that a little bit too. So that will look similar to what was shown with the Hoosier Health and Wellness Alliance map, except it'll be focused on specific coalitions in local areas. So that, say, for example, you're trying to start a coalition, you can see what other efforts are already in your community, so you're not duplicating efforts like we mentioned. You can see perhaps if you can get engaged with that coalition, or for us who are looking from a state level, we're trying to reach out to these communities. We can see who's already doing work in these communities, and we can partner with them instead of, again, duplicating efforts and working in our silos. So we're hoping that the value is twofold and morefold. That this will be useful on a local level and on a state level to find out who's working where and what their efforts are specifically addressing.
Thanks, Erin. I have a question for Lily. So I think you touched on this with the social network analysis, but do you feel that, or are you able to speak to whether the pandemic increased or decreased the amount of connections between people? Like, did you find that people were seeking more or pulling back during the pandemic?
Yeah, that's a really good question. I can't say for sure what kind of effect it had, but I know for certain, Connections in Health was making it a point. It was one of our goals to increase our membership. So, and I think probably the virtual aspect of everything probably helped that a little bit, because we could just say, here's a Zoom link, jump on. And so people were really easily able to join our meetings. If you're just curious about what is Connections in Health, you could even join a meeting and, have your camera off and, sit back and just listen. So I think it was probably a combination of those two things that really increased our membership.
Thank you. Yeah, that's a great point. Oh, Antonia?
Yeah, I would agree with that. I feel like the silver lining of the pandemic and going virtual allowed the Hoosier Health and Wellness Alliance statewide partners to all convene. And we actually have not met in person. So when we started to reconvene, it was all online. But when COVID had everyone quarantined in their house, they had more time to join the meetings. And so I thought it really did positively impact our membership and work in our favor there. So the silver lining of all of it was our membership did increase. Oh, it's time.
Good question, Gina.
Thank you. I just saw some people were hopping off, so I wanted to make sure in the last minute here that I did highlight that we'll hop back to the main Zoom link that I put in the chat. We're going to take a 10-minute comfort break. So our program will start again at 11:10. We can feel free to hop over to that Zoom link now, and there'll be just a waiting room for you. And also in the chat is now the contact information of all the speakers from today. Thank you for spending time with us this morning. We look forward to seeing you in the rest of the conference.